Well, hello, everyone. We are live. Now go ahead and just sit here for just a minute or so to give everyone time to jump on. So, yeah, I am Kristen. I am Kristen Gunderson with Gunderson's Bookkeeping, and I am here with an amazing lady named Debbie. So I will go ahead and introduce Debbie to you. Actually, I'll have Debbie introduce herself to you. So go ahead and take it over, Debbie.
Hey, well, thank you very much, Kristen. And let me just say that I'm very honored and privileged to be here today talking about mental health, period, but especially during these trying times with this pandemic. So my name is Debbie Edmund, and I am a licensed professional counselor supervisor in the state of Texas. And I have a master's degree in clinical psychology, and I have a private practice clinic that consists of a community of independent therapists located in Cypress, Texas. And at my clinic, we treat everything from children through adults. And I specialize in treating adolescents and people who self-injure and trauma.
Wow, that sounds amazing. And I just want to go ahead and welcome everyone who's jumping on here right now. I can see you jumping on. You have the chat button over on the left. If you have any questions while Debbie and I are talking here, go ahead and put them in the chat. And just let us know where you are checking in from. Where are you watching this webinar from? And I wanted to just mention really quick that about 4 weeks ago, this COVID happened, right? And I'm like, and I've been doing a lot on one-on-one, just talking with other business owners. And I started meeting these really awesome business owners who have services that either people don't know about or don't think about. And I wanted to go ahead and spotlight them. So I started a business in the spotlight about 4 weeks ago. This is our 4th week, and we are focusing on mental health this week. The first week, we talked about healthcare. The second week, we talked about buying homes. And last week, we talked about, I had a lady on who does divorces and just one-on-one with the divorces. And I thought it was really neat. I never knew her services existed. So that's how this all started. And these are all uploaded onto my YouTube page named Gunderson's Bookkeeping. And I will go ahead and put that in the chat for everyone. And after these are done, you can go back and watch them, and then we share them to Facebook. So if anyone can't catch them on live, you can go ahead and watch the replay. And I just want to thank you so much, Debbie, for helping us focus on mental health, because with everything that's going on, I believe it's so important right now. I believe that everyone is struggling across the board, no matter where they are in life or in business. Everyone is struggling. So one of the things that I wanted to go ahead and talk about is, Debbie, what happens when, say I make an appointment with you, what am I going to expect when I make an appointment with you? What should an average person expect?
Okay, well, first of all, hopefully with any therapist, but especially with me, if you call my office, the main number, you're going to get me. Because I know it's so important not to have all these middlemen in between. I want you to know that when you call me, you're going to be able to get all of your questions answered. We're going to start developing that therapeutic relationship from the get-go. You're going to know exactly how to prepare for your session when you come in, and you're going to feel safe when you walk into my office.
Awesome. And what do I need to do to prepare? I mean, I've never stepped in your, well, I have stepped in your office, but not as a client. What do I need to do to prepare to come see you?
Well, for most therapists, actually, these days, we have websites. And we know that when people usually finally call a therapist, they've kind of maybe waited too long sometimes, and they're in crisis. So we want to make things as easy as possible. So on my website, for example, you can find all of my paperwork, and it's not much different than when you're going to see your general practitioner or any other physician. We want to get a complete history on you. We want to know what you're coming in with, what your needs are. So you can do all that paperwork beforehand. So when you come in, you hand it to me. And while I might get some additional information from you, we're going to really start working. I'm going to start being able to hear what's brought you in. And you're going to find, again, with most therapists, but I know with me, you're going to find empathy, You're going to find compassion. I'm going to show up for you so that you, again, have a safe place where you can start healing from whatever it is that brought you to my office.
Okay, awesome. And I actually got to go into your office and just check it out. And I will admit, Debbie, you have I don't know, the coolest, if that's even a great term, but it is so like calming. You're awesome. Like your office.
Thank
awesome.
you.
And it felt so safe and so relaxing. I've never been into an office like it. It was really.
Well, thank you. Well, the name of my company is HOPE Psychotherapy of Houston. And HOPE is an acronym, and it stands for Healing Opportunities that Promote Empowerment. And HOPE is also home of emotional support tools that promote empowerment. And so, to make things fun and interesting. And, I believe when you come into a therapist office, oftentimes people are afraid. They don't know what to expect. Mm-hmm. And so I believe in making everything as comfortable and relaxing as possible. So believe it or not, when I designed my office, I researched everything down to the science of color. Wow. I wanted to make sure that everything was inviting and safe, and people knew as soon as they walked in, they were going to be able to find a therapist, whether it was me or one of the others at HOPE, that they could heal with. So you're going to come in, you're going to find the colors, you're going to find the relaxing music, you're going to find, aromatherapy, offices that make you feel like you're sitting in your living room while you're receiving therapy.
So what makes yours different from every other, I don't even know the different terms, but can you help explain that? What is yours and what are other therapy mental health places, and what's the difference between them?
Well, are you asking the difference maybe between the types of clinicians in mental health?
Yeah.
Okay, and that's a question I get oftentimes. So let me just go through. So everybody's probably heard of a psychiatrist. Mm-hmm. And psychiatrists are medical doctors. So they're the people that are going to prescribe medication if you need it. If you've got anxiety that is just can't be managed, even to the point where, if you go to therapy, you're not being able to benefit from it most effectively, you see your psychiatrist. They can prescribe some medication for that. After that, you're going to have people that are still called doctors, but they might be a PhD, a doctor of philosophy, or a PsyD, a doctor of psychology, or EDD, a doctor of education. But those people cannot prescribe medication. They may do talk therapy, just like I do. They may do testing if that's needed, psychological assessments, neuropsychological assessments. And then there are going to be nurse practitioners. And they may work underneath they do work underneath a psychiatrist for supervision, but they can prescribe medication also. And then you've got people like me. So I'm a licensed professional counselor in the state of Texas. Different states maybe have different designations, but there are licensed professional counselors. There are licensed clinical social workers, licensed marriage family therapists. Different states may have slightly different designations, but we all do talk therapy. Some of us do play therapy. We do different types of modalities that, again, help you work through whatever issues that you have that are going to lead you on your path to healing.
Okay. So you don't prescribe any medications then?
We do not. However, myself and most other therapists these days do believe in holistic care. Okay. So we may prescribe, so to speak, going to see a nutritionist.
Awesome. So you're
yoga
side.
Exactly.
And that's been really popular lately. I don't know if it always is, but I noticed that I'm noticing the word
holistic.
Holistic, yep, more and more.
Exactly, because all these different modalities really benefit the entire being. And of course, all of them impact our mental health and our well-being, our central nervous system. Mm-hmm. Which is, again, what therapists actually treat, our central nervous system, our brain, and our spine.
Yeah. So what happens when I go to see you? We talked about the intake, but now, like, what am I going to get when I'm in the office with you? Like, what happens in
Well, okay, so again, hopefully when you see any therapist, but especially me, I'm going to show up authentically. And so for me, what that means is I'm going to greet you with a smile. Okay. What we want to really start to do is creating a bond. And so there are all different types of therapeutic modalities. I use something called cognitive behavioral therapy. And again, I don't know how much time we have to really go into the different therapeutic modalities, but one of the most important things in terms of recovery or how much a person benefits from in their therapeutic sessions is the therapeutic relationship. So I'm going to spend some time with you answering any questions that you might have about what to expect. I can answer questions about my training, again, my modalities, so that just like when you go to a doctor's office, if they prescribe penicillin for something, you want to know how it's going to impact you. Mm-hmm. So I'm going to also spend some time talking about how what we do in therapy is not just chatting. Because oftentimes people will say, well, I could talk to anybody and get the same benefits. Well, you're going to get some good benefits from talking to your best friend or somebody that you can trust. But different things happen in therapy. So when you're sitting across from a trained therapist, we can, by looking at your body language and your facial expressions and the words that you're saying, we kind of get a glimpse into your central nervous system without taking this off, and we can actually see what your words are doing, how they're impacting your life, how they might be impacting the people that are living with you or your loved ones or whatever. So we can actually then help you come up with your own solutions and help you recognize that within yourself you have the ability to heal. So when you come to see me, for example, I try to put things in simple terms. Through the way that you communicate with yourself and your world, you are actually going to be changing your neurochemistry. Even without the benefit of medication, you're going to be releasing the feel-good chemicals that can help you to start seeing the world in a different way.
That is awesome.
It ends up being so much fun.
Yeah. And I just want to give a shout out to everyone who is on right now. Thank you for joining us. And if you want to, we would love to know where everyone is checking in from. We have Dr. Charles
Modlin.
Yep.
Charles, that's my brother.
Hi, from Cleveland, Ohio. And any questions that you have, feel free to go ahead and type them in the chat right now. We would love to be able to answer any specific questions that you have. A question that I have, Debbie, is do I have to go, like, now that, how is COVID affecting your business? Are you guys open? Can I go see you? Are you doing video conferencing instead of what's going on right now?
Okay, that's an excellent question. And actually, I've had the capacity to do video telehealth since Hurricane Harvey. I've seen the need for it since then. And I'm going to be honest with you, while research says that it's just as effective, most of my patients really would prefer to come into the office. I think there's just nothing that can take the place of actually, face-to-face, but it sure is a great alternative during COVID-19. At HOPE, it is large enough, as you said, you've been in my office, and it is large enough to practice the physical distancing.
Okay.
So there are some therapists that you can actually come in and see. Their patients are being spaced out. Most of the therapists, I think even them, are also doing the video web or teletherapy or telehealth right now. So we're all accessible. Okay. And some of us accept insurance. Some are out of pocket and out of network with sliding scales. So again, there's probably going to be somebody at HOPE that will meet your needs. Now, what I'm noticing, and I've been talking to a few other therapists, is that right now I think our caseloads are down. And that kind of concerns us because, everybody is dealing with a lot of stress and anxiety and depression right now. And while this is starting out to be situational, we're supposed to, in times like this, have some stress and anxiety and depression. That's normal. The longer it goes on without any treatment, it can become chronic.
Yeah.
And that's a huge concern because we know when we end up with chronic anxiety and stress, we've got cortisol racing through our bodies. And that cortisol is going to keep us in a fight or flight response. It's going to impact various organs in our bodies. If we are already susceptible because we have lower immune systems, or other issues that, we've been seeing all over the TV now, diabetes or high blood pressure or obesity, all those kinds of things, we're under that much more pressure physically and could lead to illnesses. So my concern is that, people wait a little bit too long to see a therapist. And we're here waiting for people to contact us so we can start that healing process. So
how do we contact you?
Well, to contact me, my number is 281-373-5200. And as I said, when you contact me, that number, I'm going to either answer, or if you need to leave a message, I'm the person that calls you back. I have a website, and I'm sorry it's so long, but it is HOPE Psychotherapy of Houston.com.
Okay.
And there are ways to send me messages through that too, and I will definitely respond. And believe it or not, it usually doesn't take me very long to respond at all, because I know that if I'm calling a therapist, I'm needing some help and I want an answer, so I don't make people wait.
Okay, how do we spell the
psychotherapy? So it's PSYCHOTHERAPY. HOPE Psychotherapy of Houston.com.
Okay, perfect. I have it up here and I'm going to put it in the chat also.
Cool.
Okay. Yeah, and right on there is your entryway into the waiting room. That's awesome. Okay, so you're in Texas, so you're following the state Texas rules or whatever.
Right.
We obviously have people on here from Ohio and other states. Can you see them?
Actually, I cannot see them per my board rules for therapy. However, psychoeducation is something different. So if somebody really wants to contact me because maybe they don't fully understand how to access mental health care in their community, they can still contact me. I actually have created some healthy coping tools. One of them is kind of behind me. I don't know if you can see it or not, but that poster,
yeah, I'm looking at that.
Anatomy of a Self-Soother. Because what I discovered early on is, working with adolescents, their families, people who self-injure, trauma, people don't have a really great concept of what it means to self-soothe. And when people leave my office, as we were talking about earlier, I can't prescribe medication, but I can prescribe coping strategies, right?
Mm-hmm.
And so people from other states can contact me and we can talk about how to self-soothe. If they choose to, they can purchase my poster and put it in their home. What a lot of my patients are doing, even before COVID-19, would be to get that poster, and then as they're meditating, they can take one of the phrases off the poster, and that might be their mantra for the day. So they'll put it in their bedroom, or they'll put it in their bathroom, or someplace where they're going to walk past it, or other family members walk past it, and they can get that support in between therapy sessions. So I can do psychoed for people outside of Texas and therapy with people inside of the state.
Okay, awesome. Kind of reminds me of PE, physical education. That's what I was thinking. So do you have any tips for us? Like right now, like what is something that you would subscribe to us right now if we are having a lot of anxiety? I've seen two of my really, really good friends in the last week post that they are about ready to lose it because they're working from home remotely. Their spouse is now working from home remotely. They're being a teacher, which they never wanted or meant to be in. I can tell you from the frustration of just trying to help my kid get onto the social studies website that they needed to do, like that took me about 15 minutes of 20 minutes, and I was very flustered.
Exactly.
Just trying to figure out how to correctly log in for my kid to do their homework. And then either they're losing a job or they're losing income or they're super duper duper busy. Like how does someone cope with all that anxiety and stress of all those things pulling at them?
Okay. Well, there are going to be probably lots of different strategies, but one of the things to remember is that we are all wearing hats that don't fit,
Yeah.
to really give ourselves some grace, to give ourselves permission to actually feel and to recognize what it means when, we're hearing everybody say, now you're not alone, what that really means. And so I imagine when you showed up with your friends, you were probably able to actually show up with that big smile on your face at first.
Mm-hmm.
Then you were able to mirror also what they were actually going through. So, we want to have empathy and compassion for ourselves, but to be able to get it from other people. So the people that we love and trust, when we're having FaceTime or Zoom or whatever it is with them, if we're sitting there crying, having that person be able to sit there with us with whatever uncomfortable feeling that we're having, knowing that, hey, wait a minute, I'm connecting on a human level. That's going to probably be the strongest bond. So making sure that we keep in touch with the people that we know we can count on, that are going to be there with us, that can sit through us with us through all of these uncomfortable situations that we're facing every day, and sometimes that are changing every minute.
Yeah.
So keeping some kind of routine, some kind of structure, keeping in touch with the people that we care about, because it started out with social distancing, and then that didn't quite sound right, didn't feel right. Now we're physical distancing, but none of that means isolation.
Yeah.
And giving ourselves permission, if we need to have kind of a freak out day. That's okay, right?
Yeah.
Or giving ourselves permission because we're wearing all of these hats that don't fit. The permission to say, I don't really know what I'm doing. Help me. Somebody else might have figured out something to help you that you haven't figured out quite yet. So keeping our lines of communication open. Remembering to breathe.
Yes. It's a big one.
That's a big one, and it doesn't have to be complicated. And I don't know if you're like me or the people are on the webinar checking in with us or like me, but sometimes we make things so complicated, right? Oh my gosh, if it's not complicated, it doesn't work. Well, that's not true. We need to keep things really simple right now in caring for ourselves. Breathing works. Let me tell you something else that works. And this is something that people think is magic and I don't know. And they come back to therapy after the 5th or 6th time and they'll say, oh my gosh, you were right. So, we have something called the limbic system. And this is the emotional part of our brain. And it's made up of so many structures. I'm not going to get into all that neuroscience right now because I think people want something simple. But it's where our emotions are registered, how we interpret our emotions. And for people that don't know, emotions are those physical sensations that we have in our body. Okay, so if your stomach is tight in knots, you might call that anxiety, right?
Mm-hmm.
Okay, but we get signals from our body to our brain, and it sends off the alarm bells, right? Oh my gosh, fight or flight. Let me stay in this situation. The problem is, evolution-wise, that hasn't really changed. So, when we're in real danger, if somebody is putting our life at risk, we're supposed to be in that fight or flight stage, right? So we can make ourselves safe. Emotionally, the same things happen. So if we're experiencing something uncomfortable, anxiety, panic, our body still gets us in that situation where cortisol, adrenaline is rushing, where we're ready to flee or fight in that situation. But most of the time, emotionally, that's not needed, right? So what we need to do is learn how to express our feelings. And, people, have all kinds of impressions of therapists from movies and TVs or whatever, how you feeling? Well, there's a real reason why we ask those questions. So here's the part that seems magic, but it's not. It's neuroscience. And I'm assuming probably everybody knows what an MRI machine is. And in a functional MRI machine, doctors can see the structures of our brain. And in the limbic system, they can actually see the amygdala, which is where kind of the fight or flight gets started to get signaled. It's over-functioning. It's gotten larger than it needs to be. It's working overtime. When we simply express feelings, uncomfortable feelings, that part of the brain starts to deactivate. Right? It seems like it's magic. All I have to do is say how I'm feeling. Yeah, that's why it's so important, right? That part starts to change our brain chemistry. Different signals are sent out to different higher level functioning in the brain. We can start thinking rationally, clearly. We can start problem solving. We calm ourselves down and we get into that rest and digest phase where we can actually breathe again. So, the biggest thing that and if people are on here and they've been my patients or they've been my students or interns, they know that when you come to see me in therapy, I'm also always helping people to recognize that they might be expressing thoughts and beliefs. They're not really expressing their feelings. So another thing is, if you express your feelings to your friend or whatever, again, that's going to be another connection on the human level, where there's a greater bond that you're creating there than if you were only expressing your thoughts and beliefs about something. It helps us connect so much. And I hope I haven't put too much information out there that can be processed. I know that was quite a lot, but that's what happens in therapy.
Okay. That kind of reminded me of something earlier that happened today. And I'll just share this a little bit. I have hired a coach for my team, okay? And it's 6 weeks long. This morning was week 5 of week 6. And every time we get together, or at least the last few times we get together, he's like, give me a word or maybe 2 or 3 of how you are feeling. And he's like, you cannot use good, bad, or fine, or any of the siblings of them. So my word this morning was flustered, because I literally just came in off of trying to help my youngest son get onto his schooling. Another word was frustrated. Another word was fabulous. And another word, I can't remember, overwhelmed or something like that. But he's like, and then he went and he explained it. He's like, the reason why I don't have y'all use good, bad, or fine is, he's like, especially with teenagers, is there's been research that if they are just using good or bad to describe how they feel, and I can't remember exactly what he said, but he said like they've done research and there's a bigger chance that they're going through anxiety or have depression or even like suicide thoughts. He's like, so you really want to dig deeper and have them use different feeling words besides good or bad.
Okay.
So that kind of reminded me of what you were just talking about, and I don't know if you want to talk about that.
Okay, well, I mean, we could probably talk for hours actually about a lot of these things. But, I said earlier that I specialize in working with adolescents. And what that also means is I specialize in working with their parents. And so let me tell you what adolescents do oftentimes, is they take on the role of protector of their parents. So they might have been harboring all of these uncomfortable feelings for quite a while, and you get them in therapy, and once they feel comfortable and they start sharing with you, they actually admit, I don't want to burden my parents. They're going through enough, all those kinds of things, because for whatever reason they don't think that they deserve the care that they're there to get. So yeah, if we just accept, oh, I'm fine, I'm good, I'm whatever, we're not getting to what's really going on with that kid. And during all the stuff that's happening right now, and things are changing daily, your child has to be feeling the same things that you are, right? And potentially magnified. And because they're so young, they may not yet have learned some of the things that we as adults might have learned. And sometimes as adults, we haven't learned what we need to learn either, right? To take care of our mental health. So talking to your kids, once again, being able to look at them, read their body language, read their facial expressions, read their behaviors, and help them build their emotional IQ by telling them, you're telling me that you're fine or you're good, but I've noticed that you've been staying in your room. I've noticed that, your behavior has changed in some way. Could it be that you're feeling, fill in the blank? And then hopefully they're going to be able to open up to you when they realize that it's safe. When you let them know that they are not responsible for your emotions and your feelings, right? You as the parent or the caregiver are the ones that's going to help them to find their safety.
Yeah.
So conversations are huge. Communication is huge. Knowing how to do that is, again, something that if you go to see a therapist, you're going to understand how to support your child in doing that too.
Yeah. I just want to read what Dr. Charles wrote. I'm sorry, I'm not using your last name.
That's okay.
In today's society, in the midst of the COVID-19 crisis, now more than ever, physicians and society need to understand the importance of paying attention to mental health concerns. Historically, many physicians and society as a whole have considered it taboo to seek mental health services or have even ignored the impact that mental health can actually have on physical health manifestations. Your webcast is very important, especially during these hard times with COVID and the economic status of America. Thank you for airing this topic. You are so welcome. And I totally agree. I know the economy is going to be tanking, but I also, I know like the domestic and the abuse is going up through the roof. I mean, and I know there's so much, like, I really think like, it just is. It's so true. Like, we are all just struggling. And I was talking to Debbie earlier before we got on this, and it doesn't matter if we have been laid off or if we're now teaching our kids, or if business is thriving, because some businesses are thriving right now. And it doesn't matter which spectrum you're on, if you're losing your job and you have that stress, or if you're stressed out because business is so busy. And I happen to be in the business is so busy, and that's where I'm stressed out. And because things have been normal, been going great for a while, and all of a sudden, a few weeks ago, I was bombarded with 8 hours of questions a day on the SBA loans and the grants and the Paycheck Protection Program, and do I qualify, and I did the best to answer all of them. But at the end of the week, I'm like, oh my gosh, I don't like, what's wrong? And I reached out to, because I do coaching, and I reached out to my health coach that I've been working with since December, and she helped me realize that I just kept on pouring out of that cup. And she's like, you know the analogy, Kristen, you have your cup, you have to have your cup full, and your cup is completely empty right now. And we need to figure out a way for you to refill your cup so that you can keep on giving to your clients and everyone else who needs your services right now. And I'm like, even though I've been getting coaching probably since last May of this time, I know all this stuff, but in the midst of it, I couldn't see where I needed help. Like I knew that I was not right, and that I was really stressed out, and but I needed that extra step. And those are services that you could offer, Debbie, and I know that you do, but that's the extra step that people who just don't see it in the midst of it, and they need that extra help right now. So,
well, for sure, and that's always the case. And again, I see parents that bring their kids in and they're saying, "Please help my child," which of course I'm going to do, and any therapist that sees children or teens is going to do. But one of the things that I do is I encourage family therapy as much as possible, because again, the parents' cups are completely empty, and they don't recognize that it's not selfish to take care of themselves first, so that they do have something for their kids and the rest of their family.
Okay. And exactly, like my health coach, she's like, "Kristen, you got to put on your mask. You're on the airplane. You got to put on your mask before you can help everyone else."
Exactly.
Okay. Trey has asked, how can college students maintain good mental health with schools closed? I have a college student that works for me, and she's going nuts, to tell you the truth. I mean, it's a lot, and she wishes that she were in class. So this is a great topic.
Well, okay. So, I wish I had one pat answer for that, which I don't. But, I don't know if you're talking about if you're in crisis or what, but I've got a couple of numbers that I wanted to really be able to give out here, and I'm glad this question came up. But there is something called the crisis text line. And what you do is text HOME to 741-741. So if that's, if you're in a real crisis, that's something that you can do. And then hopefully the person on the other end of the line, because what happens is it goes to somebody, a trained person's computer, and they can respond back to you. They can give you some resources, some things that you can do to actually create some safety in your world. They may actually refer you out to a therapist. But again, the bottom line is to go ahead and call a therapist, because even if you think you can't afford it, you don't know that. There are going to be therapists out there that are going to be providing low cost therapy probably in the next few weeks or months, or who knows how long, that you might be able to afford. If you call a therapist and they can't help you for whatever reason, they're going to refer you to somebody else. So the important thing is to know that there's some help out there, and not just to sit in isolation and to not reach out.
Yeah.
That's the biggest thing.
I wanted to text this out here. So text HOME to, what was the number again?
741-741.
Okay.
And also, just to make sure everybody is aware, that there is a suicide hotline.
Okay.
And the number for that is 800-273-8255. And for people that don't know, there are lots of different resources to be able to find therapists. I think the most popular one is psychologytoday.com. And that's going to be all over the country. I'm not sure if it's outside the country or not, but for sure it's all over this country. And so therapists register for that. I'm on psychologytoday.com. And when you go there, you put in a little bit of information, and then all the therapists that are in your area that have registered will pop up. You can read their bios, the populations that they treat, the insurance they accept, and other types of information that might be helpful in knowing if they're the right person for you.
That's great. We have Cheryl here who says, "Thanks for all the helpful information. Your services are greatly needed during this pandemic," Cheryl.
Oh, thanks, Cheryl.
Okay. Perfect. And I put the Psychology Today in the hotline, and I see how it pops up. That is wonderful. Is there anything else today, Debbie, that you want to talk about that we haven't covered today and I haven't got to ask?
Yeah, I think a big one is the fact that, and you mentioned it, and we see it all the time, plastered on the TV all the time, all the different losses that we're experiencing. And people don't oftentimes think of grief when they think of something like this. We just tend to think of grief when somebody's died. But no, we're experiencing all different types of grief because of, as you said, loss of income, loss of getting to see people, loss of all types. And so being aware, and there's a website called grief.com, but being aware of what it means to be going through these stages, because different behaviors can kind of crop up when we're experiencing grief. We might be more irritable than normal or frustrated than normal. Again, we might isolate when what we're really needing is connection. And so just to, again, recognize that probably as a nation right now and as a world, this is a pandemic. We are all experiencing some forms of grief. So to be kind to each other when we see somebody doing these things, especially our kids, parents will say, oh my gosh, so-and-so's, is acting out so bad, I don't know what to do. They might be experiencing grief. And to be able to not punish them necessarily for their behaviors or give them a consequence for their behaviors, let them calm down. And if they agree to, once they're calmed down, sit down with them, give them a big hug, a big dose of oxytocin that's going to help them feel connected and loved. Breathe with them, help them again be grounded and to recognize that they're safe.
Yeah, for sure. Okay, we got some more questions, and I really appreciate the questions. Okay, so I'm going to go through these one at a time. Dr. Charles put, we have heard that with everyone at home under the stay-at-home orders, there has been an increase of incident of alcohol and drug abuse and even domestic violence. Do you believe this is the case?
Definitely, I believe it's the case. And I don't know if you realize or if the people on here realize that liquor stores have been deemed essential. Okay.
Yeah, in Texas, you can get it now delivered with your food.
Right. And, as a therapist, we all specialize in things. I can't say that I'm a specialist in substance abuse, but I do know that that's the case. And people are trying to cope with alcohol and numb themselves, which we know is going to increase all kinds of issues once we're given the, all clear and we're back out in our lives or whatever. So yes, people are using unhealthy or maladaptive coping strategies, which can lead to greater incidents of abuse and domestic violence. And the sad part is, or one sad thing is for kids, because oftentimes their safe place was school. They're not going to school. Sometimes teachers or counselors or just other people at school were reporting when they knew abuse was happening. And they don't have that safety anymore. So, again, when you're checking on your neighbors, just be aware of things that might indicate that there's not something that's not quite right. And be aware that every citizen has the obligation to report abuse when we see it.
Yeah, for sure. Okay. Daryl has, my daughter keeps asking for the emotional support animal. What are the benefits of an ESA?
Okay, so once again, I'm not an expert necessarily, but it's about emotions. So we know, just like when we get a big hug from our best friend or from our mom and dad, whomever it is, we do get a huge dose of oxytocin. So oxytocin is the love chemical, right? And so if we've got an animal that can sense when we need some kind of emotional support and they give it unconditionally and we're able to get that animal on our lap or give that animal a big hug or it licks our face or whatever it is that it does, we're getting that dose of oxytocin. It helps us come down from that fight or flight again and get into that rest and digest phase.
Awesome. Okay. Will the country and world ever get back to normal? That's an open-ended question.
Boy, if I had the answer to that, right?
Yep.
And of course, I don't have the answer to that. It's
changed forever.
Yeah, it's going to be a new normal. And that's part of what I think is frightening for people because we're looking into the future and we're trying to predict. And as hard as it is during times like this to stay in the here and now, that's something else you hear therapists say all the time, but to stay in the present, because when we engage in that forward thinking, that's where anxiety resides. Typically, for most humans, when we get into that forward thinking, it's negative. Oh my gosh, the negative what ifs, what if this, what if that? Even therapists do that, right? We're human too. So to be in the present, what do I have today? What can I be grateful for today? What have I not lost today? All of those things we need to do so that, whatever changes happen, we'll be stronger and better prepared to deal with them.
Yeah. Okay. Michelle has wrote, I feel with the kids not attending school and not participating in any extracurricular can cause weight gain, and that can create problems in kids who have health issues.
Well, that's definitely true. And when we've got cortisol racing through our body too, that can contribute to weight gain. So again, some type of regular schedule, if you can, if your parks are open and you can practice that physical distancing, do that. If you can go into your backyard and just throw a ball, if you, do whatever you can do to make sure that we maintain some kind of physical activity.
Yeah. Okay. Do you feel do therapists feel that pet therapy is also helpful? Kind of going back to that.
Definitely. Whatever that your pet of choice.
Okay. And then what is the role of social media in making society less personable? People to communicate with each other as well as they once did. Is this contributing to the violence that we have been seeing in society, school shootings, cyberbullying, etc.?
Well, that's a complicated question. Well, of course, social media is going to impact our time spent with real people. And COVID-19 is actually presenting us with an opportunity to get off social media a bit and actually interact with people on a more human level. Although right now, a lot of us are still contacting through Zoom or these types of platforms, but it's still a face, it's still a person. It's not just hiding behind a video game or TikTok or something where there's not a real person on the other end. I can't remember where I saw this, maybe on Facebook yesterday. It's kind of a sad statistic, but there were no school shootings last month.
Well, that's really good.
It is good, but it took something like this for us to be able to create more safety for our kids. And this is an opportunity to look at what we can do in terms of our own families and creating the culture that we want our families to have moving forward into this new world, right? Our new normal. Do we want to set healthier boundaries with our kids for social media? Be more aware of the platforms that they're on, what really happens when they're on these platforms, and even limit the amount of news that they're watching. So it's an opportunity to create more health in our own, cultures of our own families.
Yeah, for sure. Okay. Are you a basketball fan?
Oh my God, yes.
Okay.
Yes.
Trey wants to know if the NBA resumes, will the Rockets win the championship?
Hey, did you say Trey?
Yeah.
Okay, I have a feeling I know who Trey is. He's my nephew. He's really trying to egg me on here, but I don't know. They were kind of going downhill before all this started, so I'm not really sure. But if the NBA is back on TV, I'll be watching for sure to cheer them on.
Okay. And then we had one more. Daryl came back, and are there any other therapy that can substitute for ESA which are helpful?
I'm not really sure. I'm completely
the emotional service animal.
Any other therapy that can substitute for an emotional service animal? Well, what I'm going to say is actually, if you go into therapy, that is emotional support.
Oh, okay.
When you're sitting across from a live person that can do the things that I was talking about earlier, they can actually create that safety for you where, to really fully benefit from therapy requires we be vulnerable, right?
Yeah.
To really start to honestly communicate with ourselves about the emotions that we're experiencing. Remember, I said those physical sensations in our body are emotions, right?
Mm-hmm.
When we can allow ourselves to be mindful, accept that we are human because we're having them, translate those into feelings. That knot in my stomach means I'm anxious or I'm irritated or whatever. When we're vulnerable enough to share that with another person, that is a universal language. I guarantee you your therapist has experienced that. Going through COVID-19 myself and probably every other therapist, it's an opportunity for us to become more human, right?
Mm-hmm.
Connect with other people on a more human level. Going to therapy is the best emotional support you're going to get.
Okay, this made me think of something. You said that we have to be vulnerable and get to trust you before things can really start working. On average, because I know everyone's different, but on average, how long does it take how many sessions is it going to take to be able to get to that level, to start digging in deep?
Well, that's a really great question too. And it may or may not depend upon a person's willingness to participate in therapy when they come to therapy. I can tell you what happens with me working with adolescents, and this is one reason why I really love working with adolescents. So, they might be drugged into therapy kicking and screaming, or they might have asked to come themselves, but there's trepidation because, come on, I'm talking to this stranger, and they're not the ones that made the appointment. They didn't talk to me on the phone. They don't know who they're going to go see. Which is one reason why I like websites, because, if you put your picture there, then at least they can look at you and look at your office and kind of feel a little bit better when they come in. But here's what happens. And I would say really 99.9% of the time, when you are able to connect with that person, by the end of the session, I always ask the teenager, how do they feel about coming back? And it's like, oh my gosh, yes, I want to come. They finally found somebody that is willing and able to sit with them through whatever pain that they presented, whatever issue that they presented. And their parents are sitting there looking like, who are you and what have you done with my child? It doesn't take long. It really doesn't, if you know how to connect with people.
Awesome. That's great to hear. Another question came in. How many visits does a person typically require and how often? I know different people have different requirements, but people want to know that in many cases, therapy is not a lifelong commitment.
Okay, that is another great question. And it's kind of complicated too. So I would say most people, when they come into therapy, if they are really engaged and they're committed to doing what we talk about in therapy, they can get some real benefit between 5 and 10 sessions. Now, that doesn't mean that everything's resolved, but they're going to start feeling a whole lot better. Sometimes even sooner. It depends upon the individual. But again, I don't know if everybody is aware of this, but therapy, if you accept insurance, and even if you don't, our license even say things like that. We're not supposed to over-treat. Now, if I'm going to go see a massage therapist and I can afford a massage therapist, I might go weekly, right? Nobody's going to tell me, and then the massage therapist, tell that person they can't come in and see you, right? Well, one of my logos is a brain in a massage chair, and it says your brain on psychotherapy, because that's how you feel when you go into therapy, right? Like you've gotten a massage. I don't want to be a person that tells you you can't keep coming if you think it's beneficial to you. Now, your insurance company may have a different viewpoint, but I'm not going to tell you you can't come. I've had patients that I've seen for several years, not weekly, but periodically they'll come in for a refresher or a checkup or whatever. And then I do have people that come in those 5 or 10 sessions and they believe that they're okay, and I might not see them again. So it can be a personal choice. But I guarantee you, really, if you come in and you're dedicated and you're engaged and you do the things that your therapist talks about, you will get relief.
Okay. And say I'm a brand new person, are you going to see me weekly for those 5 to 10 or?
Well, and initially, I think what's beneficial is, and this is my opinion, for the first month, I think that it's beneficial to come in weekly. And you're getting to know me, I'm getting to know you, that safety and that trust is being developed. You're going to be getting some coping strategies, hopefully, that you can start putting to use in your real life, home, work, school, whatever. And so once that starts, you kind of don't want to lose that momentum.
Yeah.
And then after that, I really rely heavily on the feedback from my patients, their families, or whatever, about what they believe their needs are at that point. So I'm not just going to, I'll give you my opinion, of course, about, hey, maybe weekly is still warranted at this time and for whatever reason. But if you believe that, hey, I've got some skills, my family's supporting me, et cetera, I'm ready for every other week, we'll go with that.
Okay, awesome. Anything else before we get off? We're wrapping up on about 55 minutes, and I want to honor people's time.
Wow, I can't believe we've been on this long. One of the things I told you we could talk hours, but one of the things that I really want to point out to people is that, and this is really kind of a special thanks to a population that's not given thanks very much. Mental health workers are part of the mental health field. They're part of the first responders. We are essential workers. And I myself have the ability to do video teletherapy, right? But I want to have everybody, when they have the opportunity, to get onto their social media and say a special thanks to mental health workers who are working in psychiatric facilities, acute care facilities, other places that need to remain open because patients need care. They're out there every day also putting their lives on the line, and sometimes without PPE. And, the news media is thanking all of the first responders, which of course they need to do, and all the other essential workers. But I haven't really heard too much thanks to mental health workers.
Yeah, for sure. Very, very good point. You guys are working really hard too. And I went ahead and put in to the chat my Facebook page, because that's where I'm going to be sharing this to. And of course, I will share you, Debbie, and I'll try to share the HOPE with it. And then we can get this out to everyone who may need to see it and have those resources. I think someone asked to speak. Ron, are you still on? I will let you ask a question real quick if you want to. Okay, so I'm not sure how that works. Ron, are you there? Okay. All right. Well, I guess if Ron is on, you can go ahead and speak. I'm not totally sure. You'll be the first one that I tried out with it. Otherwise, you can put it in the chat really quick. And I just want to go ahead and take the time to thank you, Debbie, for hopping on today and being able to chat with us. And just thank you, everyone who's been on and watched this whole thing. We really appreciate it. Share out those the text hotline, the suicide hotline, and all that stuff that we've written down. Oh, here, hang on, speak again. Okay, Ron, I think that you can speak. I hit the request. I don't know. But anyways, I guess if that is it, thank you so much. And again, go check out the Facebook pages and the websites and everything, and get this information out there for people to see it.
Thank you so much.
All right. Bye, everyone. Have a great weekend.